My name is Dr. Joel Chapman, and I'm the Clinical Director for the Retford and Villages Primary Care Network. We have pockets of real poverty in areas, and we have a very large elderly population with a large number of care homes. So one thing we're really looking at is particularly looking at a core of elderly frail and elderly vulnerable, but also not forgetting the younger vulnerable patients too. And we're looking at developing an in-house and visiting service for this particular group. So we want to incorporate something called patient activation measures into the long-term planning. This is something where we can empower our patients to access the best services, giving them the self-confidence to be able to look after themselves and take their health forward for the future. We believe as health professionals, this will enable us to formulate much better long-term planning for our patients. This is a very exciting journey for us. Obviously, we're only just starting on it as a PCN, but I think we've already got a clear idea where we're going and how we're going to improve things generally. This will incorporate improving the workforce as well. We're looking to employ physicians associates, physios and pharmacists in this next year to deliver this service. We've already put in motions employing a social prescriber as well, which will be working in tandem with our already existing and very effective social prescribing service. Hopefully, and all being well, these are very exciting times, and we hope to develop a lot of future services and improve the patient's care locally.
I'm Deepti Alla. I'm the Clinical Director for Newgate Medical Group. We've decided to focus on frail patients and also patients with social isolation and tackle it as a group using the local integrated care teams, which again is a new development, as well as including the voluntary sector who can support patients at their home better and understand the massive social issues that can impact on physical health. But we're also, as a part of the primary care network, trying to employ new staff in new roles to support the existing clinical staff. For example, at Newgate, we have a clinical pharmacist who does patient reviews, and they have proved extremely effective. Again, we have a teenage counsellor over the last year who has been quite efficient in dealing with teenage problems, and we have run counselling sessions from within the surgery as well as with the local schools. We hope to employ further staff in newer roles, for example, link workers that work with the community teams, as well as taking on the roles of paramedics for home visits for patients. We have excellent MDT meetings. We have members from social care. We have members from integrated health team, community nursing services, and recently BCVS have added to that group who attend our regular MDT sessions.
My name is Dr. Richard Davey. I'm the Clinical Director for Larwood Bawtry Primary Care Network. Larwood Bawtry Primary Care Network are at the forefront of trying to modernise primary care services, particularly in this region. We've already employed paramedics who are a very valuable part of our primary care team, providing acute home visiting services, as well as being aligned to nursing home for chronic disease management reviews, and are now providing acute minor illness clinics within Larwood Health Partnership. We've found that benefits to the practice so far have been more integrated working with other agencies and stakeholders that have engaged with the primary care network. These include the district nursing team, closer relationships with them. We've got very close relations with the community services and the local community voluntary services, including the Aurora Centre, Insight, Talk Zone. Within the practice, we've been able to employ pharmacy support, and we now have 3 pharmacists working with us under the PCN umbrella. This allows us to improve efficiency and safety regarding prescribing, which has a direct benefit for both clinicians and patients. Our primary care network is hopefully in the very near future employing a social prescriber who will be able to help a wide variety of clients and patients within the service.